Okay, so we're on to part two, discussion about the myths and blind spots in orthodontics that have shaped the treatment modalities so far. So question number one, tell us about the myth of the overgrown maxilla. And is this in fact a medical condition that a medical doctor should be diagnosing rather than somebody in dentistry?
Okay, not even in medicine or dentistry, but just out in the public, the lay public knows about the person who has, quote, buck teeth. And by the term alone, it basically says that the upper front teeth stick out. The interesting part of that is in a study back in 1981 in the refereed literature of orthodontics, it was recognized in patients who have class 2 malocclusions that the upper teeth rarely actually protrude given those criteria used in the study. As a matter of fact, it's almost if the upper jaw wasn't well related, it was often too far back rather than too far forward. If you then apply more modern approaches to that, you'll realize that every case the upper teeth are too far back. And in the patient who everyone would say has buck teeth, the upper teeth are actually too far back. They need to be moved forward, and the lower jaw needs to be moved forward. And when you see the face, when that's done with orthotropic treatment, which is something we do and we teach it for other people to do it, it's done on children under age 10, you'll see how wonderful the face looks, and you'll also see that the airway can open up dramatically. Nevertheless, we're still faced with people wanting to push the upper teeth back, even though it's been well known and documented in the refereed literature that they rarely protrude. Things change slowly. This was in the literature over 30 years ago. It would be an easy thing to have pediatricians and pediatric dentists screen. The first thing to happen in every case is the upper front teeth will fall down and back. So the measurement from the tip of the nose right to the edge of the upper incisor is a key indicator of that. And if that number starts to increase, it shows that the upper front teeth and the upper jaw is starting to fall back. You can see this on a child who's age 3, 4, or 5. And if we were able to screen for that, then we could help develop the whole lower face forward the way it's meant to be early on and avoid all these problems.